Yeah, thank you so much for this very interesting multidisciplinary panel over here. I think what I'll do is I will just start this introduction with a 5-minute sort of, discussion. And then we'll have each of the panelists speak for 5 to 7 minutes from their own disciplinary and institutional positions. And then we will open up the discussion for the next 40 minutes. So that's the flow of this session today. So I think what I would like to open up with is the idea that the housing question, particularly in India, has to do, there is a two-pronged sort of agenda that we would like to discuss today. First is a pre-COVID question, right? The pre-COVID question to my mind is, how have we fared with housing so far in the last 50 years? We've had a very active housing policy. For the last 30 years, we've had the market sort of involved in facilitating housing, but we really haven't fared that well. And the question is to really sort of think about together, what is the reason for this gap that we have in housing? Is it a failure of public policy? Is it market forces? Is it to do with socioeconomic dimensions or any other aspect of political economy? And I would really be interested to hear this from our panelists here. The second question to me is the post-COVID question, right? What does it mean to kind of deal with the health crisis? Is the health crisis a temporary thing? Is it a long-term thing? Is it something that will impact the way we think of housing in the future? And that is something that we have also seen in terms of a lot of our planning discourse has come from the health discourse, right? And in many ways, we've seen that often the planning discourse that has come from the health discourse has been out of sync sometimes with the sociability of cities, in terms of starting to think of plotted development, setbacks and all of that, that has also created, sometimes unsociable cities. And so how do we think of this double bind of, health and sociability of cities? And I think that is something that we will, because it's very interesting, this panel is so interdisciplinary, I think that will be interesting to bring up some of these discussions and what some of the new questions for housing are today. So thank you so much. And with that, I think I'll invite Shipra first because she has to leave for another meeting. So Shipra, can you join us?
Thank you, Rupali. Can you hear me? All
yes,
okay?
Yes, very clear.
Excellent. Thank you for that framing. Good afternoon, everyone. Thank you very much, Bunty and the Asia Society, for inviting me to join this webinar and share some perspectives around this hugely important topic of adequate housing. I've been saying this, and it sounds a bit odd. I know it'll sound a bit odd, but the COVID-19 pandemic has been the biggest ever advertisement for the importance of adequate housing that we could have had. We're the main guidance for protecting yourself from the pandemic: stay at home, practice physical distancing, wash your hands, maintain hygienic conditions. Great, it sounds wonderful, except that 1.8 billion people around the world do not have those choices. They live in slums or otherwise overcrowded living conditions, or they are homeless and sleeping rough. Many don't have access to clean water to drink, let alone wash hands 8, 10, 15 times a day. Many don't have access to a toilet. A large proportion of them work in the informal sector. They don't have the luxury of working from home, and they must use overcrowded and often crazy semi-formal or informal public transport to get to their places of work. They have minimal savings to rely on. They have no security of tenure on their housing, which is in an already uncertain environment. So clearly, existing vulnerabilities are being spotlighted and deeply rooted inequalities are being worsened by COVID-19. This was also a key message of the SDG's policy brief on COVID-19 in an urban world, which has just been launched today. For us at Habitat, it's never been clearer that housing is a right that cannot and must not be neglected if we are really aiming for sustainable and inclusive, resilient cities. And what you call, Rupali, the pre-COVID question, for us, the housing crisis has been exacerbated by, of course, rapid and unplanned population growth, but also persistent levels of poverty, not addressing the socioeconomic, the inequality question, not addressing the housing affordability question, not addressing the social housing question, and the disconnection of housing from its social function, of not just a roof over your head, but a place to live in security and dignity. That is a pre-COVID question. That is a failure of public policy pre-COVID, not just in India, but also in India, but in other parts as well. But then the post-COVID is that apart from everything else, the people's ability to afford decent housing, especially the ability of informal workers and vulnerable groups, is heavily impacted by the pandemic. ILO's estimation is that 1.6 billion people in the informal economy experienced a 60% drop in income in the first month of the crisis. Forget about now, so much. And we've seen in India the issues around the movement of migrants from rural to urban and then back from urban to rural areas, and the challenges that they cannot even afford that little tiny space, 10 people in a room in a city anymore, without a decent, without stability of livelihood. Many local and national governments have put in place mechanisms to protect the vulnerable in the pandemic, and I think those give us signs of hope that it can be done. You need the political will, you need the push, but public policy can do it, to address homelessness. Many have put a moratorium on evictions, others have given rental holidays, others have extended water sanitation services to poor housing neighborhoods. But long-term interventions are crucial. This is great. It's been done. You have water supply, you have a temporary moratorium on evictions, but unless you address the housing, the planning, and the land governance question, which in India doesn't get addressed together at all. For me, that is an absolute fundamental principle. Good planning that enables the provision of housing that is connected to livelihoods, job opportunities, access to transportation, reducing sprawl. You talked about plotted development, and there's a very dangerous discourse at this point happening around density is the problem and causing the spread of COVID. Density is not the problem. Overcrowding is the problem. Inadequate housing is the problem. And if we can address that, I think that's very important. All of this is very important, not just because of COVID-19. I'll wrap up in a minute or so, Rupali. It's also because the world is continuing to urbanize, and the demand for adequate housing is increasing exponentially. And we at Habitat are estimating that an additional 3 billion people, about 40% of the world's population, will need access to adequate housing over the next 10 years. Where is that going to come from? That's not just a retrofitting question, right? And that's why we need to promote what Habitat calls a housing at the center approach. That is, housing, the role of housing should be absolutely central to any sustainable urban development solution, to any social welfare solution. And it's not just about owning houses, but it has to be a combination of policy measures, whether it is owning, whether it is renting, whether it is company provided housing, whether it is, whether it's social housing. It has to be really a much diversified policy approach towards it. COVID has also reminded us that multiple conditions have to come together to make us feel safe and enable us to continue living and working and learning. There were, of course, the old parameters of adequate housing that we talked about, daylight, fresh air, distance, whatever. But now you also have internet connectivity. You have multiple use of places and spaces for homeschooling and home offices. So I think those are absolutely fundamental. Our own work, of course, ranges from advocacy on the right to adequate housing to helping develop concrete legal and regulatory frameworks to city and community level projects to improve affordability. But our focus is inevitably on the most vulnerable, the most marginalized. The urban poor, those living in informality, migrants, IDPs, homeless people, women-headed households. And I'd like to conclude. My final point is that housing is an issue that can only be addressed effectively through a multi-level governance approach. Bunty said in her introduction about me that I'm also the focal point for local governments in Habitat. And local governments are stretched to capacity, of course, and they're doing their best. They're at the front line, but they need national policies, especially in federal contexts such as India. At the national and regional level, you need to have urban policies that integrate housing into them, along with the economic side and the poverty reduction side. But at the local level, the link between housing, slum upgrading, planning, basic services, land governance is critical. We believe that if you can get housing right at the center of cities and at the center of urban policy, connected to services, infrastructure, jobs, livelihoods, only then can you aspire to build sustainable cities that are inclusive, safe, and resilient for all. I'll leave it there. Thanks.
Thanks, Shipra. Shipra, I am just going to sort of jump this a little bit. I'm going to ask you one question because I know you will leave and we won't be able to get hold of you after this. So just one question perhaps. If you can share some insights on some of the successful examples of affordable housing or, in other developing countries. So since you've been involved with this, some lessons that we can learn from other cases for India. If you could just sort of touch on that.
Yeah, thank you. Thanks, Rupali. And there's a lot that's happening in other parts of the world. As I said, in the context of COVID, a lot of measures, progressive measures have been taken, whether it is about, many cities, whether it is in Mexico, whether it is in South Africa, there are moves to stop evictions. There are moves to give rental holidays. There are moves to move people into emergency shelters, to convert empty housing into shelters and into homes for the marginalized. So there are many different initiatives that are happening. Problem is they're piecemeal. Where we have seen really integrated solutions are places like Barcelona. So not really in the developing world, but where we have seen really integrated solutions are places like Barcelona, places like Seattle, where they are really integrating policy measures and looking at a sustainable approach. Even in Kenya, where we are, housing is a declared policy priority out of the 4 policy priorities of this government, and is very strongly, they're looking at it very strongly in terms of slum prevention, in terms of affordability, in terms of a combination of social housing and affordable housing. So there are a lot of small examples coming up, but housing has been a neglected issue. And I want to say that very clearly. In the last 10, 15, 20 years of public policy, housing has been a neglected issue, neglected in favor of infrastructure, big infrastructure development, as opposed to focusing on housing, particularly on affordable housing. We need to bring that back into the center.
Thanks, Shipra. Can I invite Dr. Mavalankar he's going to make a small presentation now.
Yeah. Are you able to see my screen?
Yes.
Yeah. Let me put on full screen. Okay. First of all, I'm Dileep Mavalankar. I'm director at the Indian Institute of Public Health in Gandhinagar. I want to start with a big thanks to the Asia Society and organizers for thinking of public health and inviting me in this webinar. I may look a little bit odd and misfit in this whole urban planners, architects group, but somehow public health is very misunderstood and forgotten in India. It is thought to be a medical discipline or sub-discipline of medicine, which is not true. Public health is a multidisciplinary subject to prevent disease, promote health, and do the needed policy and program management to keep the society healthy. So with that brief introduction of public health, let me begin by showing you what about 5,000 years ago people do or did, not very far from Ahmedabad, 90 kilometers from Ahmedabad, Indus Valley civilization site called Lothal. And this is the bathing platform or bathroom and the drainage system created by the people in that civilization. Unfortunately, we forgot and we have to reinvent. And you can see the distances between the houses and the area in Lothal. It's a very interesting site to visit if you visit Gujarat anytime. So public health engineering and housing's understanding of impact on public health is not very new, at least 5,000 years old in our civilization. Now from there, cut to the COVID crisis now. It's a respiratory infection, very, very fast spreading. We had this unprecedented lockdown in the whole country because the disease, death, and the fear of its impact. It's very fast spread from the international travelers, major cities, and congested, and as Shipra said, crowded areas where houses are very close to each other with poor ventilation, and the risk of transmission in also other countries through public transport, markets, and congregations was the main thing which was observed. If you look at the biology and physics of COVID transmission and other similar diseases, there has been this discussion whether 3 foot is enough or 6 foot is enough. And this picture shows the whole range from Ebola to measles, and COVID sits somewhere in between, how far the droplets and the infectious particles can go. And on the right side, I have put the picture of an old pole or a lane of Ahmedabad city to show you how close the houses are. So it is likely that the transmission can happen from one house if somebody is sneezing to the next house. And these are some of the wider lanes. They are also smaller lanes. If you look at the old cities, congested markets, the new slums areas in some of the cities, which are also even more congested than the old cities, with very difficult social distancing and very difficult to isolate cases from each other. So what the epidemic of COVID is telling us, that we need a radical rethink of urban infrastructure to promote social distancing, reducing disease transmission, and reshape our cities, houses, hostels, hospitals, and you name it, including airports. And build a very strong public health system, which we started building during the British time. So many of our urban health departments are structured when the British were here, and we continued that systems. Next, I want to come to another major issue, climate change and increasing extreme heat. And this is just the beginning of climate change. I'm sure this epidemic will pass on within few months to a year of COVID, but the climate change will be with us for, I think, next 80 years or 100 years. And what we need to understand is climate is not only becoming hotter, but the daytime maximum temperatures or heat waves are increasing, as well as nighttime temperatures are increasing, especially in the cities. And given the short time, I will not dwell upon that. But with this, we did a study in 2011 about the heat wave in Ahmedabad in 2010, when the temperatures went to 47 degrees on 21st of May. And what we saw was very shocking, that the mortality of the city of Ahmedabad tripled from average of 100 deaths every day to 300 deaths during that heat wave, and 800 additional deaths happened just in 1 week following the heat wave. And following that, we developed the South Asia's first heat action plan, city-based heat action plan based on thresholds, and implemented it by the municipal corporations, the city government, and continuously since 2013. And we have been following the heat wave related mortality. And we estimate that through this heat action plan, we have been able to reduce the heat related peak heat wave mortality by about 1,200 people every year. And this heat action plan has now multiplied in many cities and throughout the country in various states. One of the things which is related to the topic about housing is to how to make the houses heat resistant through painting of the roofs, modifying the roofs, and to other retrofitting efforts by which people can get some respite from increasing temperature, especially poor people who can't afford other cooling devices except probably a fan. The third major risk of urban areas, which I want to show again through our research in 2006-7, was chikungunya epidemic. Again, a new viral epidemic. We seem to have forgotten it. It caused currently more cases than COVID and maybe more deaths than COVID, but it is forgotten. It was a new virus introduced through mosquito biting or mosquito Aedes mosquito. And we showed through our analysis of birth deaths in Ahmedabad that in 4 months, 3,000 additional deaths happened in the city because of this mosquito-borne epidemic. So what I'm trying to say is that making houses and cities mosquito-proof is also another important area we have to think about. Houses, commercial buildings, public amenities. Sometimes we create breeding places for mosquitoes in our urban design and housing design. So with that, let me just conclude by saying that housing and urban design are powerful drivers and determinants of disease and health. And architects, urban planners, public health professionals have to work together to improve health via housing and urban services. Thank you. These are some of our partners on the heat action plan work. So I just put their logos. Thank you.
Thank you, Dr. Mavalankar. With that, I would like to invite Smruti to respond, maybe 5 minutes, 5 to 7 minutes.
Yeah, that's right. Dileep ji, thank you for reminding us. This is completely not a misfit. Actually, architecture and urban planning disciplines came in perspective to improve health in cities. I think the reality of our cities today very much resonates with also what Shipra says, is that we are living in cities with 40 to 50% people living in informality. And that's a very big section of the society that just cannot afford formal housing. And we know that the markets simply do not build housing for this section. So let's face it, the real estate, finance markets and cities just do not fulfill this need. And hence the role of housing hence becomes a public good. So the state becomes the enabler and tries to fulfill this gap. And we know that slums are outcomes of failures of cities to enable such affordable housing infrastructure. And there's a need to acknowledge that big cities have just crossed the tipping point, and the real need for housing delivery today is actually in the lower income group. So if housing provision and policies could just mean to acknowledge how poor people build houses and just support that. So let's say people build houses incrementally at a pace that works for them. They design and invest in it as it suits them over a period of time. But in the absence of such acknowledgement and denying poor their land rights, cities, more and more cities and programs, as again rightly said by Shipra, 74% of land value capture is actually for beautification of cities and making cities slum-free. These programs and new policies are just pushing poor people away from prime lands. And most programs designed towards slum-free cities and building mass housing to bridge this demand gap are repeatedly failing in design. I think there has been no learning that has happened over decades. There's a serious mismatch in the imagination of such housing provision versus what people really want. So if the aim is actually change what slums look like today to what they are building in these programs, as they are doing it, I see a serious problem. In most subsidized housing designs, as you know, they're all flawed. We can pick up any city, any site of relocation, or any housing program, they just all look the same. So the question to me is that where is design in this picture? I feel that it's just a cookie cutter approach. And where are the fundamentals of architecture and urban planning? And what standards do we talk about? The building regulations, the design standards, they're just not in place, and they're there if they were built is to make these spaces much more livable. But if you walk into any of these units, I'm talking about the ones that were constructed, most units do not have basic natural light or cross ventilation. And these spaces are just so claustrophobic, and people just find it so difficult to live there. So I think if you look at even the facades, it's just so empty as the lives of the people who are moved there. So there is also no concept of any communal open space. There is nothing called as green paved landscape. So the question is that every single of these buildings that are being built in such mass numbers is changing the way we look at housing. And there are several pro-poor designs. All of these call out to explain the future of housing and what we are preparing, what we are preparing for in future. So if cities and state do not call to action to this approach, such pandemics are just going to exacerbate the situation. And, which of these preventive measures in COVID, Rupali, as you're talking, work for poor people? So how do we ask to maintain physical distancing in a 135 square feet house with 6 people with no ventilation? So I think it cuts across everywhere, to policies, to processes and programs, and it's a big responsibility of the state. This calls for design sensitivity to build cities for what our disciplines of planning and architecture were meant to do in the first place, and they have failed. These professions emerged from bigger pandemics in the medieval times, as reminded by Bunty in the beginning, but yet we are here waiting for another pandemic to tell us how to plan and design better. Right. I think I was talking about, this state of housing to be made this, and you pick up any city, I just have a few examples. They all just look the same. And these facades is what I was talking about. They're just so empty. There's absolutely no interest for people to live in these spaces. And this is how it becomes just in a matter of 7 years or 5 years. And people are being just moved from one state of housing to the other state of housing, leaving buildings to collapse. So is this the kind of housing that the current policies and programs are building to build slum-free cities? Is a very big question mark to the kind of future of housing that we are building. Yeah, Rupali, you could move the session to discussion. Over to you.
Thank you, Smruti. I think that was very relevant. I'll come back to some of those questions that you're raising, and the images that you were showing. I just want to start with Dr. Mavalankar. I think you raised some really important points to do with urban form and housing, and the fact that public health is really a kind of multidisciplinary, it requires a multidisciplinary approach. I just want to ask you, as a public health expert, what policies in urban housing would you recommend, particularly in low-income neighborhoods? What are some of the concrete policies that you would recommend?
I think one of the key things is to see how the slum populations or creations of the slum can be at least stopped and maybe reversed, which may be difficult, or to develop it in a formal housing mechanism. And there are several experiments, especially in Ahmedabad. I know them peripherally, not so closely, but slum development. So instead of relocating them, developing them with proper public health infrastructure, including paved roads within the slum, as well as water, sanitation, toilets, and common amenities, whereas the people invest in their own houses. So those kinds of things. Second, I think is looking at is from preventive medicine point of view, how do we prevent slums? And my sense is it was our short-sighted policies. If you look at the history of Ahmedabad, the textile mills of Ahmedabad came in existence almost 150 years ago, the first textile mills. And many of them built, and even in Bombay, what were called as chali or chawls, which were much, much better. It is like a row house, one room kitchen apartments for well-built, Paka apartments with toilet, water, etc. for the people who migrated from rural areas to the cities to work in the textile mills. Unfortunately, that lasted for maybe 50, 100 years, but after that the new development came and the slums started. happening. So I think we have to think of why they are happening, how they are happening, how to reverse them. Second is whatever is there, what best health services and public health services can we provide. So clean water, clean toilet, basic medical uh, services, health education, primary care, etc. So that the living standards become better.
Absolutely. I think, Dr. Mavalankar, you raised two very important points. I think the first is to really sort of look at very closely what is actually happening with, what is the urbanization that is happening on the ground, I think one thing that happens with a lot of our policies is that they're generic. They're built around a generic idea of affordable housing, and what happens in the long run is that it becomes more about a policy to incentivize real estate. Rather than starting to look at very carefully on the ground, where are the jobs? What is the requirement actually on the ground that one really has. And that's what you said with the mills, for example. There's a housing sort of a requirement which was in some ways satisfied with this idea of the new typology coming up and all of that, but really right now what is happening is there's a mismatch between what is the policy itself and actually what is happening on the ground. So I think that's one thing that is really important to start looking at. What is the kind of urbanization that is happening, and looking at it in a very, very close and nuanced way. The second is to really sort of deal with what is already there. And I think I've been looking at some of the statistics, and there is a kind of absurd figure to do with the existing housing that has been supplied with the policy framework that we already have in place, that the gap between what is provided and what is supplied is huge. We have the last, I think, 20 years, housing policy has given us only 3.25 lakh houses, with all your rehabilitation houses and your the slum authority developments and all of that, whereas the requirement is actually 17.5 lakhs. And so this is an absurd gap which is not possible perhaps to be built away. And perhaps what you're saying, what is already there, can we start looking at providing infrastructure? Can we start looking at repairing and retrofitting some of those? And I think that perhaps is an important thing to think about. The third, I think, important thing that you brought about is this idea that it's not only COVID, but it's many other things that will affect housing in the future. And the heat islands that you spoke about were very important. How does one, what is the urban form that that we start looking at to take care of some of those? Is it new, or do you have other more traditional solutions that can be worked out, where heat islands can be taken care of? And I think you were showing us some of those solutions. So I don't know if you want to talk about any, are there new policies that have to be put into place, or do we have solutions in some of our traditional practices?
I think the traditional housing in Ahmedabad was a way to remain cool within a very hot geographical area, because Ahmedabad, whatever temperatures we are seeing here now, were also seen in 1920s. So it's not that it is very, of course, they are increasing over last year. So the traditional housing solutions which are there, we have to look at. Only thing is the space available, the materials available like wood is very, very expensive. So we have to really re-look at that and see what are the possible solutions in today's socio-economic conditions, and what is affordable here. So those kinds of, I don't work that much in that area, but there are a group of architects and people who work in the housing sector, how to make it. But only thing is, I don't know whether people have started understanding the gravity of the climate change crisis. It is just the beginning, and we are already crossing almost 1 degree average heat, temperature increase, which also means that summers will be 2-3 degrees hotter, because average throughout winter and summer. Secondly, is we might go up to 3 degrees average increase, which might make that 8-9 degrees summer temperature increase, which is really, really unbearable in many, many places of the country. So I think we have to think of, and housing is meant for 40, 50, 100 years. So what we build now, people will live for next several years.
Yeah. Thank you. Smruti, I think this is, you've been showing us some of those abysmal projects, and, there is the rehabilitation projects in Mumbai, the slum rehab. These are the resettlement projects that have come from places where infrastructure was supposed to be built and people have been moved to the peripheries, and also slum rehabilitation projects. What is really sad about these is that they have relaxed all norms of setbacks and light and ventilation and all of that to facilitate the market, right? And which is why you see these kind of distances between the houses. I think one of the things to really sort of think about is that right now we seem to, this is post 90s, right, that we seem to be relying on the market to provide housing, right? But in the past, even in Mumbai, we've had a whole range of housing delivery systems, right? Whether it was the cooperative housing societies or whether it was site and services schemes that came up, right? It seems to be that we seem to have an amnesia to this variety of housing delivery systems that we've had in this city itself, right? So I'm just thinking, do you have any ideas of how one can think of alternative housing delivery systems, and what could be the role of the state, the role of NGOs, since you are representing one of the influential NGOs in the city? How do we think of this kind of gap, right? What are some of the ideas that we have?
Yeah, I think there are 2-3 things here. One is that even if we look at the history of Indian housing delivery, the role of the state has moved from being a facilitator to an enabler to then becoming a facilitator. And there is a more and more reliance on the market to provide housing. But this section of the society is never going to be able to afford that. And Dr. Mavalankar, I think, coming to the point of preventing slums is actually not a desirable thing even for poor people, but the slums is actually an outcome of the failure of the state. And it's a failure to be able to provide housing markets in a way that is affordable to them. And that's why they just they have no choice but to live in some of these areas. So in the beginning, when Spark wanted to was working with sanitation, and when community toilets were built, a lot of political will was against it to say, do not build toilet in cities because more and more poor people are going to migrate in cities. But the question is that poor people do not come in cities to use the toilet. So there is a much more bigger challenge there of why people are coming into cities, and there is no way that this is going to stop. So it's important that to accept that and to find ways of providing infrastructure that works for people. So I think a lot of these slides that I showed, some of them were also from the city of Ahmedabad. There are larger infrastructure projects that have moved people into periphery. And the challenge is twofold. One is that they have been pushed away from their livelihoods. So to put it in simpler terms, they go back behind in their life by 15 years. And that is quite a big gap for them to jump up again in their life, losing livelihoods. And there are other approaches. One is also what Dr. Mavalankar spoke about, to try to have markets accommodate poor people within that design. Why is it not possible? It is always possible to, to accommodate within these projects a space where people are not forced to relocate. And only in cases where the settlement is in a situation where the land is completely uninhabitable, like say if they're on dumping grounds or if they're under the power tension lines, it means that people really need to move. And even if that needs to happen, why can't we look for alternate lands which is available for people to move within a, let's say, a 2-3 kilometer radius where not of their livelihoods are not disrupted. So that is the approach, and a lot of grassroots have demonstrated that with governments to prove that it is possible to do that. Like, say, for instance, in the BSUP policy, and also some of these pictures that I showed are actually from the JNNURM housing program. In the BSUP policy, where in situ upgrade was possible, it had a caveat saying that it should not be, the house area should be more than 100 square meter to be able to access that policy. But there were several of these houses that just did not fit in this criteria. And we worked with the municipalities in Pune to sort of rephrase that, to, you know, cluster some of these smaller sites to be able to give them cluster housing. So there are alternatives. The problem is that one needs to allow these approaches and to acknowledge them. And talking about setbacks, I think some of these houses are, again, not in the private domain. They are all built under the housing programs. So it's just that it's easier to do it because it's pro-poor housing. So they are looked down as beneficiaries, as people that just needs to be given for free. But that's not the case. Nobody's taking, there's no accountability and there's no responsibility for what is being done, you know, and what kind of spaces they've been pushed to move into. So that's my whole, you know, thing about that. There are alternatives that needs to be explored, and there are demonstrations across the globe that people have shown how to build it themselves. It's just that there is lesser acknowledgement by the state to allow people to do that.
Mm-hmm. Yeah, I think that's, I mean, you're pointing towards, and you said that one is really sort of thinking of, you know, the idea of supporting incremental development, right? And perhaps to look very closely at what people are doing to house themselves, and how can one actually support that? And so what do you think, you know, in terms of policy or in terms of development control regulations that we have in place, where are some of the gaps and how can those be filled?
I think one of the biggest problems is that the standards, So I think one of the biggest problems is that the standards that are put in place to run these practices of architectural and development control regulations are all built for the formal setting. But the problem is that we are trying to be a misfit. We are trying to put the formal standards to the informal sector, which just doesn't work because it was not designed to work for them. So there's always an in-between. There's always a way to look at how to have standards that works for the informal sector. To give a small example, you know, poor people have always built houses with old materials, with refurbished materials, and they are not acknowledged within the standards. But the same materials, when they come with research, with a backup to say that these materials are much more sustainable, are then, you know, publicized and advertised in markets. The question is, why can't we go back and look into some of these standards to see what people build with what they can afford, and then support them in order to continue to build it? So why can't we accommodate the needs of poor people and the way that they are building in these standards, in these regulatory mechanisms? Why are we forcing that, you know, everything needs to move into formality, which is actually doing a pretty bad job the way we can see it already?
Absolutely.
And also, Rupali, to what you'd raised earlier about, you know, the measurement of targets, I think the problem is that everybody is just looking at the wrong set of measurement. It is not about the target of the number of dwelling units. Of course, the gap is what comes out of, you know, the census, but the real measurement indicator is to look at the total number of houses that were occupied. You know, even if you looked at the last housing program, out of the total big target, 74% of that was sanctioned and only 17% was occupied. 34% of that was built, which brings out that municipalities and the local level do not have the capacities to absorb this kind of funding. So I think they just, I think the wrong measurement is being sold. It actually needs to look at, you know, what is the percentage of these houses that are being occupied. So there's no indicator that measures, you know, if people are satisfied or if people, you know, are happy in this kind of setting.
Right, and I think that brings us back to your point on incremental settlements. I think I'm going to go to the questions that are raised by the audience. And maybe we can take those for the next 7 to 8 minutes before we end at 7:30. Okay. So I think one of the questions is migration to urban areas is continuously going to rise in the future, but it is a very challenging task for the authorities to cope up with this overwhelming situation. Do you see any policy in limiting migration and create jobs for these people in the native places?
Yeah, I actually love this question. We actually wait for this question to come up.
Please.
So, Sheila Patel has always said that, people who question this whole thing about migration, we ourselves and our families need to go back and ask these questions to our forefathers. Aren't we migrants of some other city? We are. So there is no such thing to stop migration. It is something that is a right to people to move where there are opportunities, and that is going to continue to happen. So I think the problem is not of policies in limiting migration. It is for cities to get equipped with infrastructure and to be able to accept and acknowledge that people are going to come in and prepare cities to be able to accommodate people. And I think it's, again, the question is, the debate is always about who is migrating. The problem of migration is always aimed at looking at the lower income groups. Why isn't migration a problem when higher income groups are moving in cities? Whereas these are the people that are actually providing or running these cities, right? So I think the question itself needs to be looked in the other way around.
Yeah, Dr. Mavalankar.
Yeah, Rupali, but I think also the other issue one has to look at is why urban areas get all the amenities, whereas the rural, like metro, it costs thousands of crores to build a metro. And we are building city by city. But if you ask how many buses go to a village, there are very few buses go to a village. And one bus a day is fine for a village. How many wells in a village are still open? Non-sanitary wells. There are millions of probably wells are still non-sanitary. Whereas in the urban areas, we build fancy parks. And so the other thing is not only employment, it is all kinds of policies by which the cities are favored as compared to basic infrastructure in rural areas. And that is where I think we have to really relook at the development parameter. It's not that, and even re-looking at the development systems. I have been thinking, why not move out, say, 5 major employment generators from Bombay or from Ahmedabad? It's not just Bombay or Delhi. Say, why everything has to be in Bombay? Why not in Nagpur and Chandrapur in some other place? Reserve Bank in Bombay, oil and gas in Bombay, this in Bombay, all government things. So I think as a government development parameter, we should see what can be moved out of Bombay, which will solve Bombay's problems. And people will not have to migrate, because what is happening is the cities are attracting more and more investments, and it becoming more and more attractive to go to the cities. And that's why the migration increases. So I think the other way to ask is, how do we reverse this as a development paradigm to see that the basic services, not only employment of clean water, electricity, good schools are available in most of the places, and which is where the Western countries have done quite a bit of progress.
Actually, just to sort of also come back to this point of the migration bogey that we raise, if we look at the statistics again very carefully in Bombay itself, this what you're saying, Dr. Dileep, is already happening. Bombay's population is growing less than the national average. And so people are actually already moving out of Bombay, but what we do is instead we kind of raise the real estate bogey. In the development plan, we said you need 9 square meter of sort of space per person, which was, this kind of abstract figure, which supported more the real estate lobby than sort of look very, very carefully on the ground on, who actually requires housing and in what form. So I think it's very important. And your question about also this idea of smaller cities, again, it's very important to look very carefully at the new urbanization trends. What is really happening in smaller cities, and what is the kind of infrastructure gap that is required to be bridged. We're not looking carefully at urbanization trends, I think. Just to go back to the next question here from Pallavi Naveen on Facebook. What are few examples of public policies that can really lead to decongesting our cities and providing a sustainable environment for the kind of density that a city like Mumbai handles? If anybody wants to deal with it, I think we've already discussed this. But Smruti, if you want to just sort of look at this question.
I think most bigger cities and the municipalities are heavily saturated, and people are making choices of other smaller, cities to move in. And to remind us that the biggest 20 metropolis is now in India. It's just in India. So India is the fastest growing economy and the biggest cities are going to be developed in India. So decongesting our cities, is a question looking at out-migration again. The problem that we need to understand is that 80% of the Indian policies are all still rural. So, which means that there is already a heavy, weight towards rural areas to develop them. And more cities and more smaller towns are going to become bigger cities in future. There's nothing to deny that. So there is no reason why one can push, people to migrate out of cities. Eventually, as in how other cities, and there are going to be alternatives to these bigger cities, people are going to naturally make these choices to move out.
I'm going to take two questions together because we don't have a lot of time, and there are 4 questions, I think, which are interesting here. The first one, I think, again, I'm going to take these 2 questions together. One, it says that private developers are key to solving this puzzle right now. They don't have any incentives to invest in designing low-income housing. How do we create aligned incentives for them to take this segment seriously? And the second question is, how hopeful are you that our central and state governments will develop the awareness and infrastructure that is really required? Developers, we've been talking about the fact that developers have only been given incentives so far, but how do we actually make sure that there is, benevolence from developers as well is also a question that we would have here.
I think the whole thing with the private developers is twofold. One is that why is housing not being provided to the demand? So in Bombay, we all know that it's simply unaffordable to have a to have a 2-room structure, to have 2-bedroom houses. But yet you see more and more of these houses are being developed to cater to that market, which does not exist. Why aren't developers or private players building studio apartments where the real need is? And there are incentives. Again, here the state plays the role to enable. The SRA policy is, a possibility of giving incentives to developers. But the other challenge is also that the margin of profit is really very high for developers. So is there, isn't there a good reason to look at investing in the social need of people? There are very few developers. There's a Nayan Narvekar developer in Pune that does amazing designs with, housing for slums. It's again within the SRA framework. So there is a possibility, it's just that there needs to be a will to do it. There is less willingness, I feel.
Yeah, Dr. Dileep?
Yeah, I'm not an expert in this area, but we should also look at the rental policies, because housing is not only development, but also renting and re-renting. And I'm surprised that in countries like Sweden, there is a policy that you can't leave a house vacant even if you own it for more than 1 year. If you leave the house vacant, legally you have to sell the house after 1 year if you have moved to some other cities. So there are many countries which have such socialistic policies that you can't have 5 houses vacant in any place, or even 1 house vacant. So we have to look at what are the supply side constraints and how can we facilitate even rental market. The second thing is, as a customer, when I went around 15 years ago to buy my first house, I came to know that this is a market which is highly intransparent. So, for example, a car parked anywhere has a number and you can find out whose car is there. But an apartment anywhere, it is very difficult to find out who the real owner is and whether there is any loan on that, etc., etc. So how to make the market even transparent so that the buying and selling becomes easier is also another whole area where I think very little work has been done. And the last issue is there has to be substantial subsidy or rental available, like in the Western countries, what they called as council houses, which are municipal houses built for migrants before they can even afford a regular house, because you can't really have a slum in a very cold country. So that model also we need to look at and see if it can be replicated.
Yeah. So there is also Mr. Manish Shah, who's asking the architects on the panel why we have not solved the housing problem. The roti kapda makan, the roti and kapda has been solved, but not the housing. So yeah, I think it's more.
Yeah, I think I'll just answer two questions. One is on by Shirina Khan. So I think the whole thing of hope comes from political will, that there really needs to be a great political will in order to deliver infrastructure that is necessary. More and more of our cities, the way political will takes it to build cities like the Shanghaian model or the Hong Kong model, we are never being able to solve this problem, because we need to understand that our needs are very different, and that the policies that needs to come up or the infrastructure that needs to be in place has to be much more contextual to the realities of where Indian cities are today. And we just cannot be borrowing some of these things from the West or from some other cities.
Yeah,
I think the whole thing about architecture is that, to remind again ourselves that architecture as a profession has never catered to the section of the society that actually needs housing. Most of, let's say architecture is only able to provide 2% of housing designs, only 2% of the population that actually can afford architects, or let's say there is lesser willingness of architects to step out and to work with some of these areas where there is a real need. So imagine if architects started working with a lot of these low-income housing for twofold. One is to understand how they are being built and to be able to use their technical knowledge to help them build better, and to understand these materials and come away from the bit of the romance of architecture to a much more realistic approach that works for people. So to give an example, there is a lot of material, a lot of architects get fooled with materials that comes again from the West or from some other research that says that why don't you test this kind of your roofing? It's much more ecological, it's much more environmental friendly. But the cost of that roofing is about 50,000 rupees, and that's the kind of amount that people can never afford. So why not look at what are the local materials people are building, and then look at solutions that can complement that? And that is something that architects as a profession are not doing. It is not catering to the society where people really need architecture.
Yeah, thanks, Smruti. I think there are two comments. We'll end with those. Vidyadhar Date, who's saying that the National Urban Transport Policy lays down that workplace should be near house. This needs a new urban land use policy. We need to stop monetization of land and must stop capitalist control.
That's true. Agreed.
Yeah, and Paul Rosario on Facebook says, would the Singapore model of strong governance work to implement the wonderful reforms suggested by the speakers in such a corruption-ridden public administrative culture of India? I'm just going to take one more together so that we can wrap up here. Tarika Kumar on Facebook. What is your view on the impetus being given to rental housing to solve issues for migrants? I think we've spoken a little bit about that, but it will be useful to sum this up. The question of governance and the question of rental housing, which has come up, and I also have a few views on that. So anyone wants to take that up? The question on governance. Okay, so I think, Dr. Dileep Mavalankar.
Yeah, I think governance is a big challenge, which somehow in India we haven't fully understood. And not only governance, it is also issue of public management. If you see our what happened in the West after Margaret Thatcher and Ronald Reagan, this whole new era came of what is called a new public management, which hasn't yet arrived in India. Very little has come. We still call our city manager as commissioner. We haven't asked him to become a city manager. IAS officer is called commissioner, collector, which is the British sort of legacy. We haven't even been able to change the name, so which is unfortunate. Second, we haven't thought of decentralizing. If you see, big cities in many other countries are divided into 3, 4, 5 boroughs, and they are independent. We still have one municipal commissioner of Bombay and one municipal commissioner of a city of Gandhinagar, which has 5 lakh population, and Bombay has, I don't know what, 1 crore population, but still one commissioner. So I think somehow in India, we are so resistant to decentralization. We should look at Scandinavian countries, understand they're 1 crore country and so much decentralization. So I think one of the issues of governance is decentralization of power and authority. Somehow that we as Indians don't understand, don't value, don't sort of bring to fore in political discussions. My last comment, and I just want to end there, it was a very interesting experiment which I saw some years ago in one of the elections. The Congress government, Congress party in Gujarat, which has never been power for last so many years, declared that before election, if we come to power, we will give you cheap housing. So please come and fill up a form in our office if you need a cheap house. And in the next week, there were lines and lines of women and men lining up in Congress offices to fill up the form. They thought that they will really get a cheap house. So what it showed is it's such a politically important agenda, but somehow the political parties haven't capitalized on this very basic need of housing and lack of housing in urban areas, in even rural areas, to ensure that people get a decent house. I think once it becomes a political agenda, I'm sure there will be a big progress seen in that area. Thank you.
Thank you. I think we've overrun the time already, but I just want to sort of sum up here. I think there's a series of, this panel is quite interdisciplinary, so we've sort of, there are different views, sometimes also divergent views that have come up. But I think what is important to really is, again, to look very, very carefully on the ground. We have to realize that, in the last 50 years, we have had several policies in place. We've opened up markets. Somebody said the developers are key to it. We've opened up to the developers also. We facilitated markets, but still there is a huge gap. And it's really, really important for us to then not just allow laissez-faire development to happen, but to look very carefully on what these forces are on the ground. Do we really look at the idea of the house as a commodity, or we look at the idea of, or shift the focus of thinking of the house to thinking of the home? How is the home really sort of made, and what people are already investing in homes? Is there a way of shifting our focus from the production of the object of the house to really sort of making the homes more habitable and sort of livable? Do we have clues from what people are already doing? Also to start thinking of the fact that we can't think of only housing. You have to look at the idea of the city. The city is home for many people. How do you invest in the city where it's possible to start thinking of spending time? And today, if you see your economy has made people into entrepreneurs. People are spending so much time outdoors, but we do not look at the outdoors as an extension of the home. The home has always been a place which has extended to the neighborhood, to the city. How do we start looking at that? Unless we look at changing our own definitions of how we think of home, we will only think of it as a commodity and only facilitate it as a real estate entity. So I think with that, I would like to end the session. Thank you so much, participants, for being here. And thank you so much to the panelists for this very interesting and enriching discussion. And we hope that we can follow up with more questions in the future, through the Asia Society page and other things. Thank you so much.
Thank you. Thank you.
Thank
Lovely.
you.